Oh, you've got to, remember, you got to have the red light on the microphone.
Chuck, you haven't gotten it
No. And if someone will remind me, I'll try to keep up with the red light or green light thing, so.
So I'm just sort of interested in
Push the
overall.
button.
Oh, I should push your button.
I was up here, so.
There'll be a lot of
Okay.
people to remind
Okay.
you to do that.
Okay. So I'm just interested in health overall, and I heard the citizen representative position was open. So that's how Al and I connected. So I've lived in Spokane all my married life. I've raised my family here. I love to read. I love the outdoors. That's just why I love Spokane. And I'm happy to have this opportunity to be on the board.
Okay, well, welcome aboard.
All right, thanks.
Okay, let's have a roll call, starting with you, Karen, please.
Karen Stratton, City of Spokane.
Josh Kern, Spokane County.
Don Condon, Spokane.
Linda Thompson, City of Spokane Valley.
Kate Berg, City of Spokane.
Bob Lutz, Health Officer.
Arnie Woodard, Spokane Valley Council.
Brian Beggs, City of Spokane Council.
Chuck Hafner.
Mary Cuney, Spokane County Commissioner.
Andrea Frostad, Citizen Representative.
Michelle Fossum, Legal Counsel.
And the Snuggle Recording Secretary.
Just as a reminder, as we go through the agenda, you'll notice that we will be having an exec session later this afternoon after the meeting. At that point in time, everyone other than the board and those other people that are asked to be here during the exec session, you will have to leave the room. But when we get to that point, I will remind all of you of doing that, okay? Citizen input at this time. It looks like we have one person. Wait a minute, I'm in shock. Where are you? Well, there you, okay, there you are, Jacqueline. Well, welcome, Jacqueline.
Hello.
You can take 20 minutes if you would
Woohoo!
like.
I should have been more prepared
But
than I had a whole bunch of stuff I could have said.
But we'll keep it to 3.
Oh, all
Okay.
right. I'll respect your 3 minutes.
Thank you.
Okay. Hello, I'm Jacqueline Gallion, City of Spokane Valley. As you know and heard, we've been through a lot this last year. The school exclusions were extremely detrimental to our children in this community. I think we can all agree there was unintended consequences to the actions of the acting health officer in Spokane Regional Health District. I recently met with my superintendent, who informed me of a meeting that took place at East Valley High School with surrounding superintendents, where Torney Smith had also attended. And I remember Torney giving a report to the board claiming that parents are not reporting things accurately. Well, my superintendent said that I want you to know that I was not at that meeting and that I would have been the first to admit that we could have done a better job for our children. CVSD has adopted written policy to ensure safer measures to be taken for our children. And I would love to see not only Spokane County schools adopt this policy, but the entire state of Washington. In addition, the electeds at this table and Spokane Regional Health District, I'd like to see you guys help push this policy for our children. You know, it's hard to make things better if you don't know what went wrong, or hearing people admit where things went wrong. So I ask, and I'd also like to know what precautions or actions that have been taken by Spokane Regional Health District to protect our children from being put in harm's way again. So if I could get a response on that, I would really appreciate that. So on both of those things, please. Thank you.
Take that under advisement, Captain.
All right, thank you.
That ends our public input. So I would like to thank the people that participate in providing the information to this board when they have a concern. But keep in mind that the written material that you provide us is duplicated in each board that receives it. If you provide it during this period of time, of course, we don't have that opportunity to read it and go through it prior to meeting, because we're here for school board, for business. And so we certainly appreciate any remarks that you might have written, emails or whatever, and the health district will certainly take care of that for you. There's a number of things I'd like to speak about. I hate this one. I absolutely hate this machine. So, just a reminder to the board, you've had this in your packet. of the Spokane Regional Health District 27th Annual Year Service Award Ceremony. If you've never been able to attend that, you'll find it very, very, very professionally done. And it gives our recognition of the fact the employees that have worked so hard.
It's not in our packet.
This was not in your packet?
No, so you can just read it out.
Geez, that's two already. One more, I can go home. Anyway, it's not in your packet. But anyway, the information is it's going to be on the April 25th, 2018 at 9 o'clock here in this particular room. So again, I'll remind you and ask you if you can be here. I know you're extremely busy, but it's a ceremony that is well worth your time and for the staff time to know that you recognize them and are pleased with what they're doing. Okay, let's see if I can come up number 3 yet. I had the opportunity to attend the community assessment public assembly that was held Thursday. And there's been 3 of these sessions. They've started about, I think, 6 months ago. And they came up with 17 criteria that things that they felt were important health-wise that we could do for this community. And they finally came up with a vote, again, like I say, on Tuesday. And the vote, there were about 160 people there. And Karen, one of the most important portions of it, you were a presenter. And would you tell the board your joke, please?
So I was a presenter, and my joke, everybody laughed, so I'll tell you here, so you have to laugh to make me feel better. What is the difference between, you can answer it.
I forget.
What is the difference between the swine flu and the bird flu? The swine flu, you need ointment, and the bird flu, you need tweetment. That was the highlight of the whole event.
It was. You got a standing applause, and I think that was really great. But nevertheless, to give you a general idea of the number 1 priority that came to work on for the next 5 years, with all variety of people come in the community, reduce impacts of family trauma and violence. Now think about that for just a minute. You know, as an old school person, I recall, if I look at this, and the other day when I looked at it, how important that is for any position that we might have, relative education or whatever it might be. The impacts of family trauma and violence. And there's a lot of it going on. So if you have the opportunity to be involved in this particular assessment and any of these committees, make sure that you are involved, because it's important we have your input, because you represent all of Spokane County in your particular capacity. So it's extremely important. Bob, would you, even though it's my report at this time, is there anything you'd like to, you're going to be saying something about that? Okay, that's number 3.
Bunch of.
Yeah. I'd like to also speak, and there will be a moment where the committee chairs, if you have anything to say, I believe we have that down under my chair report, but updates of committee chairs. So any of you that would like to speak to that, I know we've met for the Finance Committee. I'm not sure whether, Breen, you have met with the Policy Committee.
We haven't met recently. We're meeting on April 12th.
April 12th. Karen, I know, has been quite trying to take care of herself, and let me put it in that fact, for the Educational Committee. And as you well know, the Executive Committee meets at least once a month prior to this meeting in order to come up with the agenda items and so forth. So, Mary, would you like to say something about the Finance Committee?
Not much, but we did meet for the first time and kind of determine what our schedule was going to be. And one of the things that we did ask Torney to look into, and so he's looking as kind of the funding model that other counties across the state are doing, so that way we can look at ours to see if different entities are feeding into that, or if it's just fully funded by the counties. So that's one of the things that we have tasked Torney with, and he's looking into and trying to get feedback to us. So as we know more, we'll get back to you.
Okay, thank you, Mary. That takes care of my report. So I turn it over now to the agent's report, and Bob Lutz, please.
Let's see, where is the... So as you'll note, it's just me today and not Torney, and so today we'll be talking about a couple of different topic areas, agency, community, and health. First of all, where's Torney? Anybody seen Torney? No, he's actually, well, he was actually in Houston, and now he's actually in Louisville. And so he, as you may or may not remember, the agency received a Kresge Grant Award looking at health equity. And so he went down to Houston on Monday to work with Helene, and importantly, work with the health department down there. They're probably one of the leaders in health equity work across the country. And so he had the opportunity of working with them over the first 2 days. And the latter part of this week, he's now in Louisville, where he is part of a group called the National Network of Public Health Institutes, Open Forum for Quality Improvement in Public Health. That's kind of a difficult acronym. But essentially, yet again, he's working on the issues around health equity, and again, really looking at how we can advance sort of the mission of public health at addressing all people in the country. So that's where Torney is. He'll be back next week. After his travel sessions, the next Board of Health meeting, he'll go ahead and give you an update on what he learned during those sessions. I wanted to give you a little bit of an update on our opioid task force. This is a community-wide effort that we've kicked off over the last couple of months. Linda, myself, and Lynn Everson just had an opportunity to talk with Kathy McMorris-Rogers. Given the recent funding from the federal government around opioids, she had a panel discussion on issues. Linda will talk a little bit more about that. But it's pretty much understood that this is not sort of a very single factor approach. It needs to be one that is bringing to bear a lot of different organizations, a lot of different sectors. The reality is that although much of the emphasis is oftentimes placed upon physicians for prescribing practices, what we oftentimes see, as Lynn spoke to today, was that we oftentimes see multi-generational issues. So Lynn, who heads the Needle Exchange Program, celebrating, unfortunately, 27 years of effort, talked about how she sees three generations of individuals coming to her for the Needle Exchange Program. And so we're looking at a cultural problem that, again, to solve is going to take a lot more than just one agency, one sector. And so in light of that, a couple of months ago, we started to initiate this conversation, and we have a task force. Councilwoman Burke is part of that task force. And as it unfolds, the hope is that we're going to be able to roll in other sectors, to include the medical society, to include law enforcement, to include education, again, to really have a collaborative approach to addressing the issue, which we know is of significance. But again, I would say that it's not just of significance now, it's been of significance in the past, and it really at some level reflects many of the social determinants that we in public health focus on a regular basis. This is, if you will, sort of the hub and spoke model, and as it evolves, I will continually be updating you on our updates. A little bit about, we had a health officer conversation a couple of weeks ago, and the health officers throughout the state talk on a regular basis, monthly, but we also had an opportunity to meet in CTAC. Specifically, the issue we were talking about was what's referred to as the HIV Omnibus Bill that came out in 1988, and at that time sort of reflected the understanding of what HIV was. Needless to say, the understanding of what HIV is very different. And so as a result, it became sort of a necessity to relook at that legislation and make it much more appropriate to the current times. And so this is a DOH effort. Thankfully, they've involved the health officers, because as a health officer, we have certain duties and responsibilities to protect public health. And so this is, again, ongoing conversations that hopefully will be presented to the legislature the next session, that session in 2018, with hopefully updates of that legislation going forward. Two other topics of conversation for the health officers were A, around opioids, which I alluded to earlier, and then B, around gun-related violence. This is, again, sort of recognized as an epidemic. And again, although much of the focus when we see mass casualty events is on those events, the reality is that gun-related violence affects all groups across our nation. So statistically, 60+% of gun-related violence is suicide. Okay? The small percentage that is mass casualty, less than 2%, and yet that's where all the focus is. And so there is a public health approach to this, and what we're looking at doing is, if you will, sort of crafting a public health message, a health officer message, that then we would be able to share with other organizations in the state, optimally to be able to weigh in to legislators for their consideration in the fall. If you had an opportunity to attend the demonstration on Saturday, very, very powerful. I mean, it was a blustery day. I mean, literally, it seemed like the storm winds just sort of picked up and it was snowing. And there were 3,000, 4,000, 5,000 people down there of all generations. It was really exciting. There was a gentleman standing in front of me, and he goes, "The last time I was here was when I was demonstrating against Richard Nixon." And then I'm seeing 6-year-olds with their parents. So for me, it was just a wonderful demonstration of how an issue that we all recognize as important, but for any number of reasons, oftentimes political, gets sort of pushed to the wayside. This issue is, again, of public health concern. It's of national concern. And so it's exciting to see sort of democracy at work. And my hope, and I think the hope of other health officers, and hopefully I think the wish of all of us, is that this issue gets addressed in a timely fashion.
Any questions of Bob regarding the opioid situation? Okay. Go ahead.
Okay.
I thought there might be somebody to interject at that point.
Thank you. I appreciated that. As Chuck alluded to, the community assessment, it's been ongoing for a number of months. Players have been the Spokane Regional Health District, the Community Indicators Initiative from Eastern Washington, Priority Spokane, and then again through an organization that has been sort of spearheaded by the agency, the Community Health Assessment Board. Over a series of meetings, the priorities were identified, as Chuck alluded to, and although small, this is essentially the 17 priorities, 17, 18, that were identified by the 6 task forces upon which the vote was placed on Tuesday. And by far and away, what led the group was reducing impacts of family trauma and violence. Importantly, however, I would point out the importance of a word, the impact. This was brought up at the meeting, and the reality is impact is a downstream effect. We really need to look at the causes. And so that was part of the conversation, and certainly moving forward, although we will no doubtedly be dealing with impacts, we need to be looking at upstream, what are the causes of family trauma and violence. The other, again, interrelated issues, increased access and services for residents with co-occurring substance abuse and mental health issues. We call this dual diagnoses. So these individuals have either significant or minor mental health issues. It could be anxiety, depression, it could be schizophrenia. But they also have a substance use disorder. Opioids certainly is the focus right now. That's what we hear in the media. But again, locally, if you look at our data, we're seeing more overdoses from methamphetamines than we are from opioids and heroin. So again, although the focus is on opioids, we can't lose sight of the fact that this is an issue that it's polypharmacy. It's not just one substance, it's multiple. And then again, asking yourself rhetorically, why are these individuals using these substances? It's these social determinants which we know create sort of the underpinnings for which they are looking for pain relief. The third was improve affordable housing, and we certainly know that that's been an effort locally. It continues to be a challenge, but again, until those basic needs of individuals are met, it's going to be very difficult to address some of the downstream problems. I feel like the Gong Show. Okay.
That's number 4.
Maybe I should gong. One more community issue. What's called the county health rankings. This is a collaboration between the University of Wisconsin-Madison and the Robert Wood Johnson Foundation. And on a yearly basis, they put out these county health rankings. What you can see on the right is the model that they make use of. And again, oftentimes our focus in health is around clinical practice, and yet you'll see that clinical care, when you look at the research, it suggests that clinical care accounts for maybe no more than 20% of the overall health of an individual and the population health outcomes as length of life and quality of life. Rather, health behaviors, social and economic factors, and physical environment are significant contributors. And so what they've done when they do these county health rankings is they look at these factors, they have a variety of metrics, they then compare them across the state and across the nation, and they give us a rank. We are ranked 23rd out of 39, okay? Where have we been? We've been as high as 23, we've been, as low as 26. Obviously, the smaller the number, the better. We've been, again, at 23 for a while, 23, 24. The interesting thing about these metrics, however, is that you may be doing better, but then it's relative to the other counties. And so although your numbers may statistically look better, if the other counties also look better, then the number you may not move up significantly so. Irrespective, this shows that we are sort of middle of the pack, which is good, but again, given the need to really look upstream, I would argue that we have a lot of work to do.
What's the best we've been?
23.
So, we're the best we've ever been?
Yep. We've been there before. We've gotten as low as 26, where we've been at 23. And then the only community health issue I just want to talk about briefly is, yet again, flu. To date, 571 hospitalizations, 236 deaths statewide, 37 deaths in Spokane County. We were actually looking at a significant trend downwards, and then the last couple of weeks we've started to trend back up. And I think in talking with clinicians, that's what they've been seeing. Again, more flu B than what we saw earlier in the season, which is what you would typically see. But again, predominantly it's still flu A. And of those deaths, I confirmed 32% vaccinated for both deaths as well as those who have been hospitalized. And again, as I presented last month, all of the deaths have been in individuals over the age of 50, all with other medical problems, oftentimes congestive heart failure, diabetes, or end-stage lung disease, COPD. Again, as you can see on the graph on the right, 11 deaths back in 2013, 2014. We've surpassed that by quite a bit. Any questions for me? Okay, I'll ask Lynn to come up and talk all things policy.
Everything's policy. You can leave that up there.
Okay.
It's good education.
Okay.
Why not? Good afternoon. So I have three things for you today. I want to talk about state legislation, federal budget, some funding issues that have recently been approved, and then follow up with Bob's comments about the opioid discussions that have been going on. So state legislation, you had something in your packet that showed you bills related to your legislative agenda that had passed, separated from those that did not. All in all, not too bad. We had some really good wins come out this session. So I guess, first of all, any questions on kind of where we ended up with the legislative session? Any questions on that? Some things we're probably going to see next session, a lot of these kind of carry over. School safety, suicide, gun violence, the HIV overhaul that Bob mentioned, substance abuse issues, and then Tobacco 21 is going to be back again. This bill, the day before the session ended, actually got out of the House. And the problem was it happened so late that then by the time it went to the Senate would have to waive all the rules, and they would need a 2/3 vote to do that. Just couldn't get there in the amount of time that they had, so we're going to have to try again. But I don't know, fourth time's a charm, maybe? So federal funding issues, two things that we're really happy to see. One was the funding that supports our Nurse Family Partnership Program. This was renewed for 5 years. The original appropriation several years ago was 5 years. Then it got redone for 1 year and then for 2 years, and now we're back at 5 years, which we're happy to see. It just makes things so much more stable for our nurses and operations of that program, knowing there's some longevity there. Part of what happens with that program is there's substantial training with the nurses. So if there is an interruption in funding, or if they get nervous that funding might be cut, then we lose nurses. But then if we do get funding later, then having to ramp up and pay for that extra training for a new nurse is just another burden on the health district. So, and then the other issue was quite a bit of funding for the opioid issue at the federal level. So what we've seen is federal legislators coming to town and wanting to talk to us about, as a community, about what we're seeing out there happening and where we think the money ought to be focused. So we had a staff person from the Health, Education, Labor, and Pensions Committee. That is the committee where Senator Patty Murray is the ranking member. And so he came out on Tuesday, and then today was Kathy McMorris Rogers. Rather interesting, it's pretty much the same group of people at both roundtables, which isn't too surprising. And it also mirrors then the press conference that Senator Cantwell did earlier this month. And just some of the commonalities that we're hearing out there is increased focus and perhaps mandates for mental health treatment along with substance abuse treatment. Research into options for to opioids for pain control. Greater focus on non-prescription opioids, heroin, fentanyl, those things that are coming into the community and basically taking place of some of the addiction that may have started with the prescription drugs. Upstream prevention, as Bob mentioned too, all those mental, physical, social factors that lead someone to get into substance abuse problems. And then also getting more people into controlled, I have the initials here and I'm trying to remember what it was. But basically it's the professionals who help those with addiction. We have a workforce development problem here. We're constantly trying to find more people that are qualified for our opioid treatment program. They don't earn as much as some of the other professions. It's a difficult world to be in, so retention can sometimes be a problem. So that was echoed by many people in the discussions as well. So, any questions on any of that?
I was wondering who was at the table to talk about prevention or the lack of services we have in our county.
I can tell you that came up a lot. We had in these discussions, we had law enforcement at the table. We had people who run some of the facilities here. We had ER doctors. We had representatives from the health district and from CHAZ. We had WSU researchers at the table. Frontier Behavioral Health was there, just to point that one out. Better Health Together, Empire Health. VA was in the discussions. So quite an interesting roundtable, but a lot of everybody kind of echoing the same problems. And the fact that this is such a big issue and it's not a one-shot fix it to the whole thing. So.
I think one of the things that is missing at the table of all these discussions is the fact that prevention has changed in our state. Division of Behavioral Health and Recovery only funds 2 coalitions in our community. So in Spokane County, West Central and East Valley coalitions get $110,000 each for the funding for prevention only in their neighborhood. They have a student assistance specialist in their high schools, but no other high schools have those resources. No other communities or neighborhoods in our county has that. And so as we're looking at that, we've lost our county-wide prevention, our statewide prevention, and I think that our student assistance specialists in our schools, I believe, are the frontline help to the kids seeking help. And that's why we're seeing this increase, is that there's no place for a student to go for help. And I think that really has to be a critical part of the conversation.
Yeah, and Better Health Together was at the table. Bob, do you remember the gal's name? Charisse? Yeah, thank you. Yeah, she spoke to that very well. And a lot of nodding heads in the room that we need to increase that as well as the whole upfront prevention, or I should say upstream prevention of dealing with trauma in families and childhood that then add to the problem deep into the future. A lot of concern at the table that we really do have to try and get ahead of this thing because we haven't even seen the crest of the problem yet. This has not peaked, and that particularly if we don't get to the upstream and start working with kids now, it's just going to keep going.
Mary?
Yeah, so Sharice actually said exactly that same thing there to Kathy. And so she, so that sentiment was echoed, very well.
I mean, is that okay to keep talking like this? Is this time? Okay. Being new.
Discussion's good.
And this is, I'm really passionate about this because when, we have the Youth Marijuana Prevention Education Program here at the Health District as part of a 6-county region. And we get last year, 235,000, this year, 250,000 for a 6-county region to do prevention with marijuana when we're generating 164 to 184 million of excise tax on marijuana. And that is not coming into the communities for prevention. Because of I-502, people talk to me all the time, you must be rolling in the dough with prevention dollars, and we are not. And yet even the growers and providers and retailers are saying, hope you're having prevention dollars, because they don't understand that we aren't getting the money that they are paying into the state and the federal government. And so I think part of our legislative agenda or ask has got to be to advocate that money goes, the Department of Health is supposed to get up to 10% of those excise tax dollars. We're getting 2.8%, and then that's distributed across the state. So there is money available, and I think it has to be advocated for by our legislators at the state, local, state, and national level to get that money into communities for the groundwork to stop these issues. Because we've got kids, our kids are just dealing with parental use and problems. It's just very frustrating to me that as we see these problems going up and up and up, that we're not fighting for the resources to get more into our communities through the departments of health.
Yeah.
What are you
And
recommending, Linda?
Well, I'm recommending that we have meetings with our legislators and talk about where the importance of that excise tax money is. I know that the McCleary decision had to be funded in these last couple budget sessions, but I think we have to be a united voice from our community to say I-502 was about making sure there was prevention and intervention in there, and that is not where the funding is going.
Yeah.
And I would like to see us advocate as members around this board, but also from any way we can to advocate for prevention. Because if we don't have prevention, our problems are just going to continue to go up when the resources really should be there.
Yeah.
As we're seeing expansion of alcohol and marijuana into our communities, we're working with legislators through the Washington Association for Substance Abuse and Violence Prevention to educate them that this impact falls on the cities, it falls on the counties, it falls on communities. And I would just like to see at some point for the next legislative session that we are somehow working together or educating community about where those funds are not going. Because we've been talking about it for years and it doesn't seem to be helping. But if we had leadership helping from many corners of our community, we would get the resources each of our communities needs.
can I follow up just a couple of things on that? That is very much something we're doing across the state. Would love to have the board engage further in that work. The more voices, the better on that. Partly because it's even worse than only 10%. There's a 2-tier system of where the marijuana revenue goes. The first tier is 3 or 4 different entities. That's a guaranteed pot of money, including the money to the Liquor and Cannabis Board. Once that money is gone, then it's 10% of the leftovers. So it's not 10% of all funding, it's 10% of the leftovers. So not a lot to start with. And it really is up to 10%. The legislature can appropriate less than that. So this has been definitely on the agenda, but I think a stronger push would be good.
Karen?
I just have a question, because I agree with everything Linda said. It's been frustrating, and I know some council members have asked too, where are these revenues? Why aren't we getting them? Is there any way, and I don't know this, but is there a way for this board to sit down and have I don't know if it's a study session or what it would look like with our legislators and make that, the conversation to bring forward and to let them know how we feel and to kind of get everybody on the same page? Because I think that might be really helpful.
I think we can certainly talk about maybe in conjunction with the policy committee.
Yeah, I was just going to say, we can put that on our agenda for the policy committee, that as we
we can, again, work on our policy development throughout the year, but as we get to the fall, that we can invite them, just like the city.
Just
like a
county does.
legislative session.
Bring them here and tell them what we're thinking and why, and people can speak from their truth
And
and
that we
what
can
they
all
know.
get the same answer.
Yeah.
Well, and
Right.
perhaps due to the fact you're chair of the education committee, you can probably work with Linda and you can come up
Okay.
with some type of strategy, working with the policy committee, and let's move forward with that. I think it's a
Perfect.
great
Okay.
thing we can do. Okay.
Great, thank you.
All right, thank you.
Any other questions for Linda? Okay,
right,
thank you
thank
very
you.
much, Linda. Let's go to item 6, consent agenda. We have 2 items. The minute meetings from February 22nd, February 22nd, 2018. I know those were in your packet, if I recall correctly. And so I'd ask for a motion to accept them, please.
I so move.
Second?
Second.
Okay, any discussion, please? Hearing none, all in favor?
Aye.
All those against? Thank you very much. The other is the vouchers, February 1 to 28, 2018. Do I hear a motion to accept the vouchers as presented?
Move to approve.
Okay, second? Okay, any discussion regarding the vouchers? Dr. Lutz, do you have anything to say this time? I'm sorry. He used to be the one that would go through the vouchers item by item by item by item. And now since we've become the health district officer, we've kind of lost that, so we're going to have somebody else on the board. Perhaps Don Condon will take over that responsibility for us.
Probably not.
No, probably not, okay. Okay, all those in favor?
Aye.
Those against? Okay, thank you very much. There are no action items. Report. Julie Albright, please. Julie?
And then where do I go for mine?
Did you put it in there?
I don't know.
Do you know where it's at?
Ann has it.
Ann has it. Secret file.
Prepared this time.
They got it in there.
Is it? Here you go. Yep, that's it.
It's for public health.
How many government employees? A new joke. Thank you. You're welcome. Always a backup now. After last meeting. So, I'll let you go. Thanks. Good afternoon. I'm Julie Albright, and I'm the interim director of the opioid treatment program. I've been at the health district for about 13 years, and I've been in the opioid treatment program all that time. So our staff consists of the division director, medical director. We have 42 staff. Oh, sorry. We have 42 staff members, and for the opioid treatment program. You can see the list that we have up there. We do have a medical director, Dr. Jeff Maple. He's also the medical director over at the jail. With the expansion of the medication-assisted therapy, we used 4 medications. And the 4 medications is the methadone, and the program here at the health district started in 1990. Before that, it was at YFA, and before that, it was at Deaconess Hospital. And in 2016, we started buprenorphine with naloxone, otherwise known as Suboxone. And last year, we started Seputex, the buprenorphine. This year, we will be starting naltrexone, which is Vivitrol. They're the 4 medications that you can use in an opioid treatment program. Does anybody want to know about any of them?
Any questions?
I have a basic one. My question would be, what makes one better than the other?
Well, that's just it. They're all different in one way. Another way, they're all kind of the same. The methadone and buprenorphine, the methadone's a full agonist, the buprenorphine's a partial agonist. The buprenorphine has naloxone in it. In 2001, they started buprenorphine. What they found was people could crush it, and they could snort it and shoot it. So that's why they put the naloxone in it. So with the naloxone, if you crush it, you can't shoot it or snort it. You'll go into withdrawals. And then the naltrexone is a blocking agent. So with that, it just blocks all your receptor sites. All of us have in us what's called a mu receptor and opioid receptor. And so when somebody becomes dependent upon it, there's a difference between dependency and addiction. You can take the medication and be dependent upon it. But when it becomes an addiction, is when you're not taking it as prescribed. You're going out, you're maybe stealing, you're doing missing family functions, you're doing other things too. And then the naltrexone, what it does is it's a blocker. So you don't get a high off of it, and it only works for somebody who's on a really low dose. So because you can get a shot for 30 days, and it's an intermuscular shot. Dr. Les, you can correct me if I'm wrong. It's an intermuscular shot. And so with that, it lasts for 30 days. And then you have to have another shot to keep it going. Somebody who has a high tolerance level, they're finding that it hasn't worked very well for them. So that's the difference. One's a full agonist, one's a partial agonist, and then one's a blocker. The opioid treatment program, like I said, began in 1990. In 2006, we had 275 patients. 150 of those were on Medicaid. Currently, we have 950 patients, and we're increasing. We have a minimal wait list now. When I first started, there was a 2 to 3 year wait list for people to come on that was on Medicaid. With the Affordable Care Act, that made it so that people could come on. We received more funding from Medicaid at that time, and so more people with Medicaid funding could come on our program. It costs about $457.50 per month, and that depends on how many days are in a month. It's $15.25 per day. Opioid dependency is also, it's a chronic brain disease. And with that, we're a harms reduction model. And I want to read you kind of about it. It's similar to type 2 diabetes. The best way to manage a chronic disease is by lifestyle modifications, behavioral therapy, and support from family and friends. Medications are only for disease stabilization and harm reduction. They cannot cure a chronic disease. The treatment of opioid addiction has been fragmented. Majority of clinics and centers offer an agency-centered treatment. There are methadone clinics, Suboxone clinics, detox centers, and abstinence-only treatment centers. In comparison, other medical and/or psychiatric chronic diseases are managed by specialists in a patient-centered treatment model. Diabetes treatment, for example, does not have insulin clinics or metformin clinics. There are no diabetic coma centers or non-insulin nursing homes. Addiction has been stigmatized for centuries, and so has its treatment. We offer that true patient-centered, comprehensive, integrated treatment model. All of our counselors, they're bachelor's, master's degree counselors. We have the nurse practitioners, as I said. We have medical. We have all of our dispensing nurses are RNs. And so we're looking at the person as a whole person. With the integration of medical, we're looking at integrating how we can get more medical in with our program. In 2017, we began dispensing at the Spokane County Detention Services up at the jail. Right now, we dispense to currently admitted patients to OTP. We also dispense to pregnant women. We go up and do an assessment on them and then dispense to them also. Also, Kootenai County brings their pregnant women over for us to dispense to also. We're working with the jail to be able to work with inmates for the initial assessment and enrollment. We've hit a couple of roadblocks, but we're working those out with the jail. Financially, we're a $5.4 million 2018 budget, and that's going up because of the patients we're bringing in. We're a fee-based program. We take Medicaid, we have a couple grants, Veterans Administration contracts, private insurance, and that's one contracted at this time, and private pay. With the private insurance, starting January 2019, we're going to be working with the MCOs. So we're working on our contracts now with all 5 MCOs, managed care organizations, so that we will be working through them instead of our BHO, our SCR BHO, Spokane County Regional Behavioral Health Organization. Our program's a standalone program. We take no local dollars. Our typical patient is 18 to 77 years of age.
That's typical.
Pregnant women, people that are in the workforce, students, parents, mental health, veterans, and homeless. It knows no bounds, no social economical bounds. We open at 5:30 in the morning so that patients that go to work can come in and be dispensed to before they go to work. We close at 1 o'clock in the afternoon. We're looking at maybe doing a split shift too because of our growth. And so that maybe, because we get so busy at 5:30 in the morning of people needing to get to work, that if we stay open longer and maybe do a split shift, what will happen is they can come in after work then. Our regulations are, we're regulated by the DEA, the Drug Enforcement Agency, the CRBHO, the state DBHR, SAMHSA, and the Pharmacy Board. Every one of those come in and regulate us. They look at our files to make sure our counselors are doing what they need to do. They want to make sure they're getting the best bang for their buck. They make sure that we use only evidence-based practices. And DEA makes sure that we're using the medication appropriately. Here's our dispensing hours. Our people that come in, you would not know them on the street, the majority of them. We have teachers, we have nurses, we have just an array, wait staff, taxi drivers, we have some long-haul drivers that come in. We also do courtesy dosing. So if somebody's from another clinic, they can come to us to be dispensed to if they're in Spokane. The same as our patients. If they go to another state, another place, there's clinics all over the United States that they can go to. And some have went overseas, and we contact those facilities also. Any questions?
Julie?
Uh-huh.
This is on a $5.4 million grant. Is it renewable, or how long does it last?
That's not a
So
grant.
when will it terminate? You said it was?
It's not
It's not a grant.
Oh, it's not a grant. What is it then?
It's all the different payments that we
Okay,
get.
because you had mentioned grant. I just wondered
We have 2 grants.
specifically. Okay.
One grant's $187,000, and the other one's $110,000.
Okay, thank you.
Yeah, Mary.
So you said you have a minimal wait list, and that was one thing that we were hearing earlier. So what is your wait list?
About 2 weeks.
Okay.
It used to be 2 to 3 years.
Yeah, no, that's why when you said it was minimal and you said 2 to 3 years, I'm like, well, then let me know what it is in comparison then. Okay.
One of the other things I'd like to let everyone know too is that we do some drug take back. Well, what we have are drug take back pouches. And so this company is DEA regulated. And Cordant, our laboratory we use for urinalysis, they're also by the DEA. They can take drugs back too. So as I was coming over here, there was a woman that just came and got 4 of them and filled the 4 bags up. And all they do is put their medications in the bag, take the seal off, seal it, and put it in the mailbox. It's all postage paid and everything. So we have those at our front desk also.
Any other questions?
Yeah, Brina.
How many people in detention services are you serving, and is that going to expand, or?
We're hoping that it'll expand. We're working with the jail right now. There's just been some kind of hiccups for having enough staff for them to be able to be there for when the nurse practitioner has to do the intake. For our assessment, we have that figured out and how that's going to happen. It's the intake piece.
Okay.
And so if they're already on our program and they get picked up for old warrants, something like that, they call us and let us know that they're there, and then we go up and dispense to them every day. So we're also open on Sundays too. and that's to go up to the jail to be dispensed to. But if somebody, say they go to the hospital, they go to the emergency department, they're admitted for a day, and they weren't able to come in on Saturday, and the hospital dispensed to them instead, then they don't have their Sunday take-home medication, because they also get a take-home medication for Sundays here, if they meet the criteria for it. If not, then what happens is we're open from 9:15 to 9:30, or 9:45 every Sunday. So for those that maybe miss their dose and they're pregnant, for whatever reason that they don't qualify for that Sunday dose, they can come in and be dispensed to on Sunday also, and for holidays also.
And further, if I'm remembering from my orientation, but you also do behavioral counseling on site here as well?
We don't right at this moment.
Okay.
We are wanting to expand into that, yes.
Okay, thanks.
Any other questions? Thank you, Judy.
Thank you.
Okay, at this time, we're going to be...
State Affairs, but it's a recovery program that's working.
Yes.
It's applauded. It's amazing. They're restoring lives.
So we should.
Okay, let's go to, we'll now get into executive session at this stage. So for all those other than the board members, you are excused. It'll last approximately...
I think 5 minutes will do it, and it's for personnel review under 4230, 141G, and legal issues, same one, 1I.
Okay, thank you. We reconvene the Health District Board meeting at 1:38. And at this stage, we'll go to item number 10 with board member check-in, please. Starting with you, Karen.
I was just going to add on your discussion about the community assessment with Priority Spokane. If anybody is interested in looking at those community indicators, you can go to the Eastern Washington University. You can type in EWU Community Indicators, and it will take you to those indicators, and you can look at the information that from the last time they did this. You can look at the categories that we looked at as we had the discussions in our different groups. It's pretty interesting to see how some of that plays out.
Okay, thank you. Josh?
Nothing.
Dr. Condon?
Yeah, I just want to talk about family trauma. You know, we call it ACEs in clinical practice, adverse childhood experiences. And, oh, it's not on. Well, maybe I...
Maybe
you don't want to hear what I have to say.
Thank goodness somebody else did that. Yeah.
Okay. ACEs, adverse childhood experiences, and they can be anything from physical, emotional, sexual abuse, or observing the same, or tobacco abuse in the house, or alcohol abuse, or drug abuse, or arrests and jail time, etc. It's just endless list of stuff. But the more that that child has experienced, to a point, it will reduce their life expectancy up to 20 years. So, and the reason is because they tend to mimic what they saw. So, you know, someone who's been abused as a child turns out to be a child abuser as a parent, and so on and so forth. But primarily they tend to go into drug use, alcohol, tobacco, depression, and so on and so forth to address their pain. So my point is that those are easily identified as in youth and, you know, in grammar and high school and so forth. And they can be taught alternate lifestyles. The reason is that their life expectancy is reduced is because they choose to mimic those previous lifestyles that they saw. So if they can give alternate, you know, ways of dealing with their experiences, then it can be a preventive thing. So that's what I would advocate, that we take a look at that, because that was on the top of the list of the people that they were concerned about. And it's, ACEs is the term we use clinically.
Okay, thank you.
You bet.
Linda?
So I just wanted to report, we had our first Spokane Valley Youth Voice, a gathering of our high school students in Spokane Valley, and it was an awesome experience. We had youth from Central Valley, University, West Valley, East Valley, did I say West Valley, Gonzaga Prep, and just a couple independent students who came. And it was so interesting to see the chart up here about what's a priority for our community, because that's what the youth came up with. We had them do a resume of tables, 3 tables of youth, and they came up with the priority issues they want to work on are homelessness, jobs for youth, finding ways for them to help their families or just have a job on their own, and then substance abuse and violence, and particularly some crime they see in the parks around drug abuse. And I thought that was interesting. I was prepared for, we want a skate park, or we want, and they were very thoughtful. And there was a wide variety of young people who came who said, normally nobody wants to hear what I have to say. I'm kind of out here. I'm either a gay youth or I'm a youth of color. They didn't call themselves youth of color, but they said, nobody wants to hear me. And it was moving. I mean, the adults who came and helped, and we were practically in tears when they left because it was so awesome to have these young people. See, it was just moving. And I said, okay, I'll see you in May. And they said, no, we're coming in April. And I'm like, okay. So we will have another meeting, and I'll be able to take back to the Valley Council, what's happening. Our council is very supportive of hearing our young people, and we're just trying to see how this is going to go. But we have greatness in our community, and it's just wonderful to be a part of that. So I wanted to report back that they're seeing what we're seeing, but they're living in it a lot. One of the youth said, there's a homeless problem here in the Valley, and one young girl said, there are 1,500 homeless youth in Central Valley School District alone. And they were shaking their heads, no, there's not. Yes, there is. And they started, as they talked among themselves, knew that there were kids they knew that were homeless because they didn't realize couch surfing is homeless, and families living in cars. I mean, they didn't even know some of the kids that, so anyway.
Well, it's kind of interesting. It's 1,500 now. I can recall 20 years ago, the figure was between 500 and 750.
Yeah.
So it's certainly increased double regarding that. Kate?
Nothing for me, thanks.
Okay. Arnie?
I'm a youth. Nobody wants to hear from me. Nothing.
Well,
Nothing.
wait until you say something, then we'll know. So.
An update, the county was awarded, mostly with city lobbying, a $2.4 million grant for a crisis stabilization center as an alternative to jail. So when a police officer has arrested someone and they think really it's a mental health or substance abuse, they can take them to this 24 to 72-hour facility. They get stabilized, medical treatment, and then placed in a more appropriate place than the jail. So that's exciting. We're going to get the money in just a few weeks, and we have a whole team working on that. And then we're also working on Community Resource Center. And for a while there was a debate about that resource center, what it was going to be. It's mostly supposed to be social services, again, to keep people out of jail. And they were going to put some jail beds on the top, but now they're going to split those efforts into two. So some good planning that should reduce crime and how much money the whole system costs for us.
Thank you.
Nothing at this time.
Okay, Mary? Okay.
And nothing, thank you.
Okay, Andrea? Okay, and I said my say, so do I get a motion to adjourn, please?
I'll move to adjourn.
Second.
Okay. All those in favor?
Aye.
Okay. Thank you very much, everyone. Have a good day and a good Easter. Our next meeting will be April 26th.
I think so. Yeah.